Greetings. My name is Kelvin Kolala, and on today's show on the TV, we have two lovely guests, and our topic of discussion is antimicrobial resistance. Now, to those of you who may not know what antimicrobial resistance is all about, that is what we're here to talk about, and we'll be able to take you through what antimicrobials are, what examples are there, and what the resistance is. And with me today to discuss this is Blessings Kasenge as well as Ingutu Kaluva. Both of these are medical students here at Regional Campus. And Blessings happens to be the former president for the debate club, which won twice in a row the debates on antimicrobial resistance. Ingutu happens to be part of an organization that is advocating for antimicrobial resistance called YAMRES. So I'm just going to let them introduce themselves and tell us a little bit about themselves. I will start with you, Blessings.
All right, good afternoon, viewers. So my name is Blessings Kasenge, and I'm a seventh year medical student. I'm a member of YAMRAS, as well as an antimicrobial resistance awareness champion, I can say. Yeah, so I have participated in two of the previous debates that were hosted on the topic of antimicrobial resistance, for which I was guest speaker in both of the debates. Yeah, so I'm really happy to be part of this particular interview concerning this topic.
That's great. And you?
Good afternoon. My name is Ingotu Yvonne Kaluva. I'm a publicity secretary in the Youth Antimicrobial Resistance Ambassador Zambia, YAMRAS. And I'm really excited to be here. I would like to just advocate for YAMRAS and to learn as well as sensitize about antimicrobial resistance.
Okay, and that's awesome. We're glad to have you on this segment as well. So let's just get right into it. First of all, it's really important that people understand what antibiotics are and antimicrobials rather. So these are the common drugs that we take as individuals whenever we get an infection. So we have the antibiotics, antivirals, and fungals. All those combined together form what we call antimicrobials. And you know, their their job is to fight these microorganisms that are common in the environment and cause infection. So essentially, Ubuntu, what happens when there's antibiotic resistance or antimicrobial resistance? Really?
So, would you like me to define antimicrobial
Yeah, sure.
resistance?
That we can
Okay,
start
in
with
my
that.
own words, I would say that it's bacteria that is not responding to any kind of medication that we may prescribe as medical people.
Okay.
So it's like our patients who keep on getting sicker, and it's just, I feel like it's a pandemic waiting to happen.
Uh-huh.
Yes.
Okay, actually, the WHO once said that this is a global
Yes.
health concern and a pandemic, if you will. Okay, so Blessings, why is it important that we talk about this antimicrobial resistance? Like, why should people out there be aware about it?
Yeah, so I think as Inuit was rightly put it, antimicrobial resistance is a pandemic on its own. I think from what we can see from the coming of the COVID-19, a lot has been talked about the COVID-19, but AMR has been there actually for a very long time, actually longer than COVID, but very few people out there know about it, and it's actually a killer. And we could see that with time, most of these antibiotics, as you have said, will become useless because all the bacteria would have resisted all the antibiotics that are currently there. So it's important to talk about it so that people use them rightly,
Yeah.
and people use them for the right reasons also.
Okay, so then that would bring us to this question, and I'm sure a lot of people are wondering: are they factors that are contributing to the rise in antimicrobial resistance, just amongst our people in communities? And what would these factors be? You can give us some of those factors.
Yes, so some of the factors that are contributing actually to AMR, I think the biggest factor is lack of awareness. A lot of people don't know about it, and
Okay.
we can't blame people for falling into a ditch that they have not seen, but most people don't know about it. And the second thing also is that among those that know it, most of them are actually not paying much attention to it. So there's actually an overuse, and there's a misuse of the antibiotics or the microbials in this case. So I could say these three are the biggest factors that are driving AMR.
Okay. And what do you have any other factors you
The FDA actually says it's mainly the overuse and the misuse or the abuse of medicines that are leading to all of these, of the antimicrobial resistance.
Yeah.
So I would feel those, and as well as sensitization and people not knowing about it, is the main factor.
Okay. So I'm guessing that's where YAMRAS come in.
Yes.
Okay. So YAMRAS stands for
Youthful Antimicrobial Resistant Ambassadors in
in
Zambia.
Zambia. And what are you as YAMRAS doing to raise awareness towards antimicrobial resistance?
I'm glad you asked that. We want to engage young people to talk about it, to just start the conversation, as well as debates. We have a lot of programs
Okay.
that we are about to launch. I can't disclose of them so far because they are not officially, but we just want to raise awareness to the youth, especially because at least if the youth know about it, we can educate our parents, and then because mostly antimicrobial resistance is going to affect our parents, and if we can at least, how can I say, if we can start small with the youth, we'll be able to educate the other generation and the generation after that. Yes, that's what YAMRAS hopes to do. Yes.
And well, Zambia is a very youthful nation.
Yes, it is.
So educating the youth is actually a step in the right direction because we make up the majority of the population, really. Yeah. So, Blessings, you have led the Ridgeway Debate and Speech Society through 2 victories in these debates that are organized by the Zambia National Public Health Institute every year on antimicrobial resistance. Just briefly tell us how that experience has changed your view towards antimicrobial resistance. Like before those debates, were you even aware of antimicrobial resistance, or they were a wake-up call for you?
Okay, luckily I was aware,
Okay.
but I didn't take it as seriously as I'm taking it now. Yeah, so the debates have really changed my view on antimicrobial resistance because I'm really now taking it seriously. I'm taking it as something that is of more concern, actually, the most concern. Because when you go out there in society, every time someone has a fever or every time someone has a flu, the first thing that comes to your mind is I have to go and get antibiotics for myself at the pharmacy or somewhere. But that is a wrong practice. Yeah, and that has really opened my eyes. I'm able to see now to say, okay, these are wrong practices. Yeah, so as rightly put it, we have been champions. So we actually came out second, the previous one, last year's debate. Yeah, the one that CBU won. Yeah, and actually one of the reasons why we formed the debate club was because of AMR. It's what led to the formation of the Regional Debate and Speech Society. And ever since we've been participating in the debates, we've really seen that there's a change actually amongst our students, and then also being part of the team. Even as we went to ZMBC, I feel that has raised a lot of awareness. And so far, we can see many people actually coming on board. A lot of youth are beginning to talk about it now, and people are beginning to take it seriously. So I think that has really changed from the time that I started debating.
Okay. And it's good to hear that not only has this impacted your view about antibiotics, but you're also raising awareness through debate and these other activities.
Yes.
So then, what can the community do to also help in the fight against antibiotic resistance? Ingoto?
Okay. I would say the community should follow the public health guidelines, and we should also make sure we take our antibiotics or prescribed things as prescribed. Because how when we don't take them to their length of prescription, that means that's when AMR starts. Right. So I feel like following public guidelines, not taking any unprescribed medications, and to follow what your doctor says.
Okay. So if I understand you correctly, if I go to the hospital and the doctor gives me a prescription of the antibiotics, one of the things I need to do is that make sure that I finish that course.
Yes.
Okay? Because if I don't finish the course, then I'm exposing the bacteria to small levels of the antibiotic that will not be enough to kill it, but allow it to gain resistance.
Yes.
Right? And the other thing that the community can do is also not overbuy antibiotics. Which brings me to this second question, right? We are in a pandemic right now,
Yes.
and one of the biggest challenges or things we've seen is how people, anybody with a cough, anybody who suspects they have COVID, are quickly rushing to the pharmacy to get antibiotics to treat such things, right? So, how do you think, as azithromycin to be specific,
Yeah.
how do you think the pandemic has is going to affect the fight against antimicrobial resistance? Let's start with you, Blessing.
Yeah, so as you put it, Kelvin, from the time that the COVID-19 pandemic started, we've actually seen a rise in the misuse as well as overuse of these antibiotics, specifically azithromycin, as you've said. And the World Health Organization has actually proved this. A lot of people are self-prescribing azithromycin each time they've got a flu or each time they feel COVID-ish or COVID-like symptoms, and which is wrong.
Yeah.
So, COVID-19 pandemic has really affected the fight against the MR because it's sort of like shifted towards a negative direction. But so far, we're heading towards the right direction. But the COVID-19 pandemic has worsened things because people are actually self-prescribing, or people are scared of also being discriminated. So they'd rather not go to the hospital. They'd rather just buy the antibiotics because they've heard that azithromycin has been seen to work. And yes, it's been seen to work, but only in severe cases and not in mild cases. However, I'm hoping that with the coming of the vaccine, I feel we might be heading in the right direction also, because I feel the vaccine, most people will be rushing to get the vaccine and not azithromycin as it was. Yeah. Yeah.
Okay, that's actually a good point, and perhaps the public need to know that it's not everyone, like Blessings put it, that should use azithromycin as antibiotic. So if you're feeling a cough and you suspect it could be COVID, it's better you go to the clinic, they do the test, and only when it is confirmed that you have COVID with a superimposed bacterial infection, that's when it's right for them to take an antibiotic. Because COVID itself is a viral infection. So the antibiotic does very little to actually help, right? And it's just contributing to the rise in resistance to these antibiotics. So then, there might be somebody out there that's wondering, okay, so you guys are talking about this antimicrobial resistance. Why should I worry about it? Like, what's gonna happen if we have this resistance? So what? Okay, like, so what? What do you think is will happen eventually if we don't take care of the little antibiotics that we have that are actually working in our communities?
Calvin, it's going to be a chain reaction. Honestly, first off, we will increase the hospital burden because our medicines are not working now.
Yeah.
So that means that we need to find stronger medication.
Yeah.
So now, if you stay longer in the hospital, that's more infection. So thereafter, stronger medication, side effects very harsh.
Yeah.
And initially, like essentially, it's going to end up in death, especially of our patients who are critically ill and who are within the range of 30 to 50 years old. It is just it's going to increase our hospital burden and increase the cost of medications as well.
Yeah, and it's even just the cost of treatment as well.
Yes.
Because the higher you go up the chain of antibiotics, the more expensive it becomes.
Yes, very true.
And really, being sick is not in the best benefit of the community, because people, when they are sick, they cannot work, and when people aren't working, means our productivity also goes down. So it's like an apocalypse about to happen if we don't take care of the current antibiotics that we have. Okay, so Blessings, do you have anything you'd like to add to that?
Yeah, I think as it was already put it, increased hospitalizations. Because what will happen is that all the antibiotics, as we said earlier, will become useless. And even for very simple illnesses, probably like a cough or very simple, maybe upper respiratory tract infections, all those will actually not be treatable. Yeah, and we're going to see an increase in the number of deaths by very simple diseases, very treatable diseases. So already that has actually started already. As you can see, most penicillins currently they are not working for most of these diseases. So the more that we continue misusing and overusing these antibiotics, the more we're actually digging a pit for ourselves, and eventually we're going to fall into that pit. So that's why it's very important that the message gets across, so that we avoid this overuse and this misuse, so that at least we treat these simple diseases with the right antibiotics and not reach a point where we cannot even treat anything at the end of it all.
Okay. So, wha- how can we bring more people on board to really fight, especially on the part of Yamras? I understand you are quite a new organization, and it's because you've seen the rise in these antimicrobial resistance trends that inspired the formation of the organization. So, how can we engage more people in this fight, and how do you plan on engaging more people?
Okay, it's usually the use of social media.
Okay.
Yeah, which a lot of people, a lot of young people especially, are on social media. So we are hoping we can advocate for AMR sensitization by engaging media houses to fight with us, because together we can. At least if we join hands together and say we want to end this, or we actually, it's impossible for us to actually stop AMR.
Okay.
It's inevitable.
Yeah.
So what we are trying to do is just slow it down. Yes, one doctor actually echoed that it is actually inevitable. But then young people have a stand. We can fight against this. Social media, we can start campaigns, we can start talking to people door to door. We can just try to have the conversation.
Yeah. So, in closing, let's start with you, Blessing. What advice would you have for that listener that's listening to this program, and their eyes have been opened about antimicrobial resistance?
Yeah, so the advice that I would have, firstly, I think I would love to add something also to what Inetu says.
Yeah.
I think we need to really strengthen our sensitization. And this sensitization should cut across the board, not only youths, but I feel also we need to engage the older population. Because you know that majority of people may not be on social media.
Yeah.
So I feel we need to also use other methods of sensitization. As you rightly put it, the door to door, we need to get the message across.
Yeah.
If possible, even translate it into our own local languages, so that even the least of our citizens can actually be able to understand what AMR is and can take the necessary precautions.
That's
Yeah,
true.
so the advice that I have for everyone is that please, AMR is a global health issue and we need to take it seriously. So whenever you feel ill, whenever you feel sick, it's better you visit the hospital and they prescribe for you the right medications, and like self-prescribing your medications on your own, because as we can see, this is actually what is driving AMR. And then also take time to just read up on AMR, especially youths, those who've got smartphones. You can always Google what AMR is and just read up on it. And also educate the adult population, because we know as youth, we're the ones that are more innovative, definitely, and we're the ones that are actually going to make a big impact towards raising this awareness. So as youth, whatever knowledge that we have, let's ensure that we also share it with our adults, we share it with our parents, so that everyone at the end of it all will know about AMR. The COVID-19 pandemic has also been a game changer. It's changed how people view antibiotics. People think antibiotics can easily be bought, and people think antibiotics can cure literally everything, which is not true. So we need to take care also. And of course, concerning the COVID-19 pandemic, the vaccine, I believe, will be a game changer also, because the vaccine will definitely change how we view antibiotics also, because people will be rushing to get the vaccine and not the antibiotics. So I think let's sensitize the public against the overuse as well as the misuse, and let's continue raising awareness as youth. So I think that those will be my last words.
Wow, that's really amazing. Good.
I don't know what more to add. That was very powerful from our former president. I would just like to just add and say, make sure you take your medication the right way, especially the way that your doctor has prescribed it, and don't just use medication anyhow, whatever you find on the countertops. And let's work together, because together we can change this. Together we can prevent all of this.
Okay.
Yes.
Well, as we conclude, we've heard it, folks. Antimicrobial resistance is real and is an emerging problem, not just here in Zambia, but globally. It's really up to all of us to take part in this fight. You and me have to actively engage ourselves in this fight. But it begins with us understanding that this is a problem and there are factors that are contributing to it. And my colleagues have taken time to highlight some of these factors, which include overuse and having too much access to antibiotics over the counter. Okay, things like not finishing your antibiotics when they are prescribed at the hospital. Things like sharing antibiotics with your neighbors that were left over. All these are some of the factors that are contributing to this uh, pandemic, if we will. And perhaps in closing, I'd like to say, most of the people out there know about COVID 19 because we took the awareness of COVID 19 wholeheartedly. And I think it's one of the topics that has been well discussed, such that even in the remotest parts of Zambia, they know it. If we could go with the same approach on antimicrobial resistance, then definitely it's something that we can fight together. So I would like to thank you both for joining me on this segment on Unza TV. And to our viewers, please like our page, like our YouTube
As
channel,
well as
and
Yamra's.
also like Yamra's as well as the Ridgeway Debate Speech,
Society.
the Ridgeway Debate and Speech Society. So thank you, and till next time. Bye.
Bye. Thank you.